Young adults aged 18 to 25 years experience a greater rate of mental health disorders than any other age group. Having licensed professionals available to help treat and guide these students could not only be the difference between the student dropping out or graduating, it could also be the difference between life and death. Effective care and treatment as part of a comprehensive approach to preventing college student suicide ideally means having trained healthcare providers on and off campus who use best practices to assess and treat students with suicidal thoughts and behaviors. When people encounter someone experiencing distress or expressing thoughts of suicide, they often refer them to formal or professional helpers, typically some type of mental health care that ranges anywhere from outpatient individual therapy to acute inpatient care. In fact, that's what many suicide prevention gatekeeper training programs teach participants to do. However, what does good care for individuals at risk for suicide look like? Many people are surprised to learn that few mental health professionals are trained specifically in the assessment and treatment of suicidality. When responding to someone with suicidal thoughts, professionals may seek to hospitalize, sometimes without considering other treatment alternatives. Many communities have multiple levels of care so that patients can access the best available care in the least restrictive setting. However, hospitalization is the most restrictive and costly treatment option, and actually does little to effectively address suicidal thoughts and behaviors. In fact, there is evidence to suggest that entering inpatient care for suicide risk may put some patients at even greater risk of dying by suicide, as well as discourage some patients from disclosing suicidal thoughts again in the future. Therefore, hospitalization really should be a last resort, reserved only for those at imminent risk of harming themselves or others, and without other alternatives for keeping them safe. When a student is identified as being at elevated risk for suicide, it is best practice to engage in safety planning and provide lethal means counseling before the student leaves the appointment. While these interventions do not directly treat or eliminate suicidal thoughts and feelings, they are essential to keeping individuals safe and are considered a standard of care for individuals identified as at risk for suicidal behavior. Collaborative safety planning with lethal means counseling involves the healthcare provider and student identifying a structured plan for maintaining safety in the immediate future. Generally, safety planning includes the individual identifying their personal warning signs of an emerging crisis, such as shifts in mood, triggering situations, and specific thoughts or behaviors. Preferred coping strategies that can be done alone, such as relaxation techniques, exercise, or listening to music. People and places that can help distract from suicidal thoughts without having to talk directly about their distress. Social contacts who can provide support during honest conversations about the individual's emotions and suicidal thoughts, such as friends, family, and religious or community leaders. Professional contacts who can provide crisis support, such as a therapist, primary care provider, support group, hospital, or crisis line. And steps needed to limit access to lethal means during periods of high risk, such as having someone else administer medications or removing guns from the home while the individual is struggling emotionally. Safety planning and talking about reducing access to lethal means can help keep an individual safe while transitioning them into treatment for suicidal thoughts and behaviors. See our website for free training opportunities in collaborative safety planning and lethal means counseling. As part of a comprehensive approach to campus suicide prevention, we must ensure our on-campus clinical care providers feel confident and competent to work with these students, and that students are being referred to effective treatments for their concerns when necessary. Clinical staff members working with students at risk of suicide need to be trained in at least one evidence-based treatment for suicidal thoughts and behaviors, such as Collaborative Assessment and Management of Suicidality, also known as CAMS, Cognitive Behavioral Therapy for Suicide Prevention, or Dialectical Behavior Therapy. Once you've ensured your clinical staff are well trained and prepared to work with students with suicidal thoughts, it is important to make sure policies are in place that allow clinicians the autonomy to work with students to develop a safety plan instead of requiring an automatic referral for hospitalization. To effectively care for students at risk, administrators on your campus and the directors of health and counseling services should also thoughtfully discuss what the scope of service will be for both health and counseling services, who will respond to after-hours mental health crises and concerns, and when it will be necessary to refer students off campus. While it is important to have a well-trained clinical staff on campus whenever possible, counseling may not always be the most effective care for a student based on their needs or preferences. For this reason, it is important to know and identify other campus and community resources where students can seek the care they may need. Students may experience distress for a number of reasons. For example, a bad grade in a class could mean a student is no longer eligible for a graduate program or scholarship. This bad grade could lead to overwhelming anxiety or grief, and even elevated risk of suicide. While this is a significant problem, it may be more effective to make a referral to an academic coach or advisor than to a clinical counselor. Similarly, a student may experience loneliness and homesickness. Again, this may be a significant problem that could lead to thoughts of suicide, but a referral to student activities staff to get better connected on campus could be the most effective next step. With this in mind, let's identify on-campus resources where you can refer students for further care and support. As we review possible resources, use the worksheet to document what you currently have in place and what you may add as a part of your comprehensive suicide prevention plan. When a student is experiencing overwhelming academic demands or concerns with coursework, time management, organization, or uncertainty about a major or career path, they could best be helped by speaking to staff and career services, or by attending workshops on sleep, time management, or goal setting. Additionally, they can discuss study skills, dropping a class, or potentially taking a leave of absence with academic coaching and advising. Many students will experience adjustment issues when coming to college. These are highlighted by a feeling of loss, lack of belonging, and loneliness. Students have found peer counseling, residence life activities, grief support groups, and participation in clubs and activities have a great positive impact. If a student in distress indicates their greatest concern is related to finances, working with a financial aid specialist to discuss options might be best. Some campuses offer financial hardship support for members of the campus community through Spiritual Life, Community Service, or Dean of Students offices. Additionally, these students may best receive care by going through a financial planning workshop or a one-on-one financial advising meeting. It is also important to look at your own website. Several schools have found it helpful to create one or more pages dedicated to mental health. These pages act as a mental health toolkit. Students can use the page to find answers to common mental health concerns. For example, if a student is having trouble sleeping, the page may provide helpful sleep tips, as well as links to apps or better sleep resources. Likewise, a student may be wondering how they can set up an appointment with one of the above-mentioned offices. This is also a great location to house helpful contact information for campus and community resources. Trying to decide the next, most effective care option can be overwhelming. This is one of the benefits of having higher education case managers on staff. These professionals work with students to determine the next, most appropriate level of care or resource. On many campuses, case managers receive reports of students of concern and then individually follow up with students to help connect them with the appropriate level of care as needed. Case managers also work to develop professional relationships with community partners where they can refer students. As we discussed earlier, not all effective care and treatment will be found on campus. As you take inventory of what you have on campus, also research what is available in your local and regional communities. When a referral off campus is necessary, it is very important to know and even have memorandums of understanding with community organizations and professionals so you can make referrals in a clear and timely manner. These resources may change from year to year, and it is important to have someone responsible for updating your list of community resources each year. Now that we are talking about community resources, you may be wondering who you might refer students to in the community. This answer will be different for every campus, depending on the scope of service of your campus mental health services and the resources available within your community. In some cases, the resources needed by the student are in a different community or even state. For example, some students with significant disordered eating may need to travel to another state to find appropriate treatment. At other times, you may refer a student to a care provider in your community who can meet the needs of the student that are outside of your counseling center's scope of services. When these kinds of referrals are needed, it is helpful to have a vetted list of qualified providers in your area available and easily accessible to the student. Depending on the size and scope of service of your counseling center, psychiatric services may not be readily available on campus. It is not unusual for a person in the community to wait months for an appointment to see a psychiatrist. Having a memorandum of understanding with a local psychiatrist can greatly reduce the time your students have to wait for a much-needed psychiatric evaluation. Additionally, some nurse practitioners are certified in psychiatric nursing and may be a valuable alternative if a psychiatrist is not readily available. In general, a referral to psychiatric services would be handled through your health and counseling services, but could also be made by an administrator, such as the dean of students. Finally, many campuses are beginning to contract with 24-hour telecounseling, psychiatric, and support service apps. These virtual options allow students to connect with a counselor or mental health professional when it is most convenient for them. They also offer self-help resources, such as mindfulness activities, basic self-assessments, and effective coping strategies for common mental health concerns. Many schools find these apps are helpful in addressing after-hours and distance education needs. Once you have developed an effective care and treatment plan, your campus suicide prevention team should ensure it is documented and shared with all members of your campus community, including faculty, staff, students, families, and potential students. By being clear about what you can provide and where students can access additional support when needed, students and families can have confidence in their ability to address their mental health care needs while on your campus.